Hi everybody, this is Dr. Mike Majmundar with Northside Plastic Surgery here in Atlanta. We are talking about facelifts today. Facelifts are a very common procedure. I'm a board certified facial plastic surgeon, so all I do every day is facial surgery. And so it's one of my favorite things to do. We get a lot of common questions about facelifts, and so I wanted to address some of those during this video. First of all, will I look weird? It depends on how the facelift is done. In our practice, we do something called a natural facelift. That's what we're known for. That's what people come to see us for. And that's how we stay so busy, is because of our natural lifts. The idea is no one should know that you had it done, and someone should be able to sit right next to you and not tell that you had a facelift. And so that's how we do that. Second question we get is, how about scars? Like, I'm going to have scarring. Well, the incisions are hidden very, very well, and they're virtually invisible. Usually the incisions go around the ear. I'll show you on me. They go around the ear like this, then behind this part of the ear, the tragus, and they go around the earlobe and then back behind the ear. And so obviously you don't see this part of the incision because it's hidden behind this flap. Believe it or not, you're not going to see this incision because we all have a nice crease or a shadow there, so that hides beautifully. And you don't see the incision behind the ear, of course. It's this incision right here that you can see for about 3 to 6 weeks, depending on what type of skin you have. So darker skin types, usually about 3 weeks. Fair skin is usually about 6 weeks because they tend to turn red a lot easier. So you may have to hide that incision with a little makeup or use your hair to cover it, and that hides really, really well. But once that heals, you shouldn't be able to see it. The downtime with facelifts is on average about 12 to 14 days. Now, you're not in bed the whole time. Typically, you're up and about the night of the procedure. Nobody takes pain medicine for this stuff anymore. We don't have to do that anymore. But you are up and about after the procedure, and we just can't have you doing any heavy lifting or working out or getting anything that gets your heart rate up, because it'll just make you bruise and swell more. So we don't want you doing that. Another question we get is, how painful is it? Well, as I mentioned earlier, 98% of people don't use the pain medicine we prescribe them. Almost everybody just uses Tylenol. However, everybody's different, so we give the pain medicine to everybody so that you have it in case you do need it. Another common question is, do facelifts include neck treatment? In our practice, all of our lifts that we do include complete treatment of the neck. And so, because tightening your face is not going to look good unless we address the neck at the same time. And so typically facelifts involve a little bit of liposuction in the neck if you need it. It may involve tightening the muscle in the neck if we need to. And then of course tightening the muscle underneath the skin and the skin itself to give you a very natural lift. The other common questions we get is, where do you perform the surgery? Well, we are fortunate. We have our own fully accredited surgical center here on site at Northside Plastic Surgery. It's referred to as a Greater Atlanta Plastic Surgery Center. We have several surgeons that use it in the community, bring their patients here. It's a very safe center. And that's where we do your procedure. It's another 5,000 square feet, just on the first floor below Northside Plastic Surgery. And we have our own anesthesiologist there who put you to sleep. They're MDs, board certified. We don't use nurse anesthetists here at the Greater Atlanta Plastic Surgery Center. And that's where your surgery would be. And those are the most common questions we get. Thank you.